Hello everyone, I am Dr. Shweta Jain from iMantra, and in this video we'll be talking about lazy eye, which is also called amblyopia. It is one of the emerging eye problems that children face when their eyes fail to develop with age. So it is important for us to have complete knowledge about the lazy eye. In this video we are going to cover various aspects like what is amblyopia, what is the cause of amblyopia, how can we treat a lazy eye. So let's get into the video. What is amblyopia? Amblyopia, also known as lazy eye, is one of the most common cause of visual impairment in children. It occurs when there is a visual impairment in one eye. This happens because the eye fails to work properly with the brain. Amblyopia generally occurs in early childhood. The most prevalent reason for its occurrence is the visual abnormalities in the nerve pathways between the retina and the brain. The eye may look normal, but the brain favors the other eye and the weaker eye receives less visual signals. Therefore, the inefficient eye is not stimulated properly to coordinate with the stronger one, leading to vision problems because of weak nerve cells. If this is not treated properly in time, it might lead to permanent vision problems. Sometimes it may affect both the eyes. This was a brief introduction about amblyopia. Let us now jump to the causes. So the leading cause of lazy eye is strabismus. It occurs when there is an imbalance in the muscles around the eyes, which might lead to turning or crossing out the eye. This muscle imbalance creates difficulty for both the eyes to track an object together. It can be inherited or can be the result of near or farsightedness. It can also occur due to some eye injury in the childhood. Another one is congenital cataract. Children who are born with congenital cataract or have some other forms of ocular deformity are likely to develop a severe condition of amblyopia. The last one is uncorrected refractive error. Uncorrected refractive error can lead to lazy eye, which is called refractive amblyopia. So don't slack off on your eye appointments, because over time your refusal to put on a pair of glasses can actually lead to a lazy eye. These are all the causes of lazy eye in children. Now comes the treatment. You do not really need surgery to treat a lazy eye. There are few methods that can easily treat the problem. So how can we treat a lazy eye? The nerve connecting the eye to the brain forms in childhood. Therefore, the chance of getting fully cured of the lazy eye tends to reduce as the patient grows in age. By proper treatment and precautions, amblyopia can be cured up to the age of 7 years. In some rare cases, patients recover up to the age of 17 years. In order to get good and quick result, one must start with the treatment as soon as the disease is diagnosed. There are a lot of treatment options that can be opted for treating a person's lazy eye and make him or her capable enough to use both eyes effectively, just like normal human beings do. Corrective glasses or contact lens. Lazy eyes can be treated by wearing glasses or contact lens of different powers in both eyes. The eye that functions properly will use the contact lens or glass with less power, whereas the eyes that does not function properly, that is the lazy eye, uses the lens with more power. Wearing eye patches. Eye patches are a sort of covering for the treatment of the lazy eye. By keeping their normal active eye covered with the eye patch, the lazy eye is forced to see objects, and hence this helps in the reactivation of almost dead nerve cells connecting the eye to the brain. Eye patches are used to cover the normal eye to make the lazy eye better in vision. Wear the patch for about 6 to 7 hours daily for better results. Before using the patch, the patient should consult his or her doctor about the duration of use, etc. The duration can vary according to the age of the patient and to the seriousness of the condition of the lazy eye. Bar-Gerter filter. For children who cannot wear eye patches, use a Bar-Gerter filter. These are just like eye patches. The only difference is that if the patient agrees to use Bar-Gerter filter instead of the eye patch, he or she must use these filters on the dominant eye for the complete day, whereas the eye patches need to be used for 6 to 7 hours only. The opacity, density, and other factors of the filters can be adjusted according to the seriousness of the condition of the patient and the age of the patient. Atropine drop therapy. In some children, atropine eye drops have been successfully used to treat a lazy eye. One drop is placed in your child's good eye each day. Your eye doctor will give you instruction how to do this. Atropine blurs the close-up vision in the good eye, which forces your child to use the eye with amblyopia more, thereby strengthening the lazy eye without having to wear an eye patch on the good eye. One advantage of using atropine eye drops to treat lazy eye is that it doesn't require constant vigilance to make sure your child is wearing their eye patch. In a study of 419 children younger than 7 years of age with lazy eye, atropine therapy produced comparable result to the eye patching. Improvement in visual acuity in the amblyopic eye was only slightly better in the patching group compared to the atropine group. As a result, some previously skeptical eye care practitioners are using atropine as their first choice for amblyopia treatment over patching. However, atropine does have side effects that should be considered, including light sensitivity because the good eye is constantly dilated, and difficulty seeing near objects clearly during the treatment. Treatment of strabismic amblyopia, lazy eye caused by the misaligned eyes, often involves strabismus surgery to align the eyes, followed by the use of eye patch on the dominant eye and some forms of vision therapy to help both eyes work together equally as a team. It may be necessary to wear an eye patch for several hours each day or even all day long for several hours or weeks to force the brain to start using the lazy eye normally. In many cases of strabismic amblyopia, surgery must be performed to properly align the eyes before eye patching, atropine use or eye exercise for the lazy eye will be effective. Lazy eye surgery is an incorrect term. The correct term to describe the surgically straightening the eyes is strabismus surgery. Sometimes more than one strabismus surgery is needed to attain adequate eye alignment. Also, special eyeglasses with prism lenses might still be required after strabismus surgery to enable the eyes to work together as a team or for lazy eye treatment to be effective. Exercise. You can follow a certain set of instructions to correct your vision as well. Hold the pencil some distance away from your child's eye. Bring it closer to the eye until it becomes blurry. Once the image formed of the pencil starts appearing blurry, move the pencil away. Repeat this exercise. This exercise pressurizes the affected eye to look at the pencil and hence recognize it. As long as this eye is not involved in the daily activities, there are less chances of the disease getting cured. So that was all about amblyopia, its causes, symptoms and treatment methods. If you found this video helpful, please like this video, hit the subscribe button and let us know about your views in the comment section below. Thank you.